Approximately half of all women experience some form of sexual difficulty at some point in their lives, with the most common being a lack of interest in sex or low sexual desire. When sex suffers, it impacts all other areas of a person's life. However, it doesn't have to be that way. Through this session, I will share a revolutionary approach to improving desire, arousal, and satisfaction. Before I share with you what that is, I want you to take a moment and think back to a sexual encounter that stands out in your memory as wonderful, fantastic, and truly memorable. What made that encounter so special and powerful? You can press pause now and recall it vividly in your mind, bringing up what you taste in your mouth, what you feel in your fingertips, maybe what you smell and what you hear. Now, if I were to ask the same question to 15 or 30 different people, I would likely hear a variety of different stories about the location they were in, what activities they were engaging in, and the people with whom they were engaging in those activities. However, I'm fairly convinced that there would be one common thread running through all of those stories, a profound sense of presence. In those moments, nothing else mattered. In other words, you were using the power of the present moment, or mindfulness. I believe that mindfulness is the key ingredient that makes for the most satisfying, memorable, and wonderful sexual encounters. The art of being fully present in the moment, paying attention non-judgmentally, is a skill that anyone can learn, regardless of relationship status, age, or your fitness level. Now, while the concept of mindfulness may seem simple, its implementation can be challenging. But fear not, because the skill is already within reach for each and every one of us. It may need some dusting off in practice, but it holds incredible potential for creating a deeply satisfying sexual experience and forging rewarding sexual memories. Welcome to the Cultivating Desire, where I will share with you a powerful approach to awaken desire, arousal, and pleasure, both inside and outside of the bedroom. I am Dr. Lori Brotto, a registered psychologist, a professor in the UBC Department of Obstetrics and Gynecology, and author of Better Sex Through Mindfulness, How Women Can Cultivate Desire, and my workbook, the Better Sex Through Mindfulness Workbook. Drawing from 20 years of research in helping hundreds, if not thousands of women cultivate more exciting and fulfilling sexual experiences, I will guide you through an exploration of sexual desire. First, we will delve into the top 5 reasons behind the loss of sexual desire. Then together, we will uncover why mindfulness can be one of the most powerful and long-lasting tools available to awaken desire at its core. At the end of our session, I will provide you with a 3-minute mindfulness meditation practice. This invaluable tool can be used not only before an intimate encounter, but also before a work meeting or any moment when you seek to tap into the power of the present moment. By embracing this practice, you open the door to a more vibrant and fulfilling life. Whether your goal is to overcome a sexual difficulty or simply give your love life a boost, mindfulness can be the catalyst for transformation. I invite you to join me in the Cultivating Desire session and embark on a journey towards unlocking the immense power of mindfulness to revitalize your sexual experiences and embrace a more vibrant and fulfilling life. I want you to think about any encounter that you've had in your life, a sexual encounter that you recall as being wonderful and fantastic and memorable and so etched into your mind that you can pull it up extremely vividly. And if I were to ask that question of 15 or 30 different people and then ask them the details of what made that sexual encounter so wonderful, we would probably hear 20 different stories of where they were, what they were doing, what kind of sex they were having, who they were with. But I can also guarantee you that there will be one commonality in every single one of those stories. And it would go something along the lines of, I was so present that nothing else mattered. I was so in sync with my partner that every touch I was hanging on. I was so in the moment that all of the worries about tomorrow and yesterday were completely gone. In other words, the common thread that makes for the most satisfying and memorable and wonderful sexual encounters is mindfulness. And so, because of this phenomenon, it really encourages us, it almost behooves us to learn a skill that is so easy, but not simple. So the ease of it is all we're doing is paying attention non-judgmentally, but it's in the implementation that it's not quite so simple. But it is a skill that any of us can learn, regardless of how many years or decades we've been in a relationship, how old we are, how much past experience we have with things like yoga or not. Turns out that even old brains can learn to be mindful and benefit from it quite potently. But it's also a skill that every one of us has in our back pocket. It's there waiting to be used. Maybe it needs to be dusted off, and maybe we need to get some practice with it. But it's a skill that it has such an incredible return on investment for creating the satisfying sexual experiences that are what make those incredibly rewarding sexual memories that you have. My name is Dr. Lori Brotto. I'm a registered psychologist in British Columbia, Canada. I'm also a professor and Canada Research Chair who devotes my time to the study of women's sexual health. The topic of sexual health is such an important one because, of course, the World Health Association has declared sexual health as the core component of quality of life. We know that when people experience sexual health and satisfaction, they're more likely to be healthy, they're more likely to report satisfaction in their relationships. And of course, when sexual health is not optimal, so when there are difficulties in that area, it can directly impact things like self-esteem, mood, relationship function, quality of life, compliance with medication, and so many other parts of their function. Of course, one of the big challenges is finding the right resources. So whether it's locating a qualified and licensed professional that can guide you to exploring different facets of your sexual wellness and perhaps even suggesting treatments to you, or even going online and finding evidence-based information can sometimes be a challenge in wading through inaccurate information and myths and whatnot. So thankfully, there are some resources. There are ways to find qualified sex therapists. The Society for Sex Therapy and Research, or STAR, online. So that's stargaze.org. They have a great Find a Therapist website, all with licensed qualified sex therapists. ASECT is another North American organization that you can use to locate someone. And I often advocate to people, ask your primary care doctor who is in their network of trusted professionals that they might recommend that you see. So let's start by talking about what sexual desire is. And, it's worth mentioning that people define sexual desire in different ways, mostly by defining when they don't have it. So we'll often hear someone saying, I'm not interested in sex like I used to be. I don't initiate sexual activity like I used to. I decline my partner's initiations or invitations to sex. I don't feel excited in my body anymore. And so people tend to have an easier time defining when desire is absent than defining when desire is present. Long ago, we used to believe that sexual desire was something that just you were born with. You were born with a set level of desire, and it was spontaneous. It happened out of the blue. It led you out of nowhere to seek out sexual activity. Why? Because you felt desire. And that was the prevailing model of desire for decades, if not longer than that. The problem with it is that doesn't accurately capture how most people in contemporary society experience desire. So it led to a lot of people feeling very broken because they didn't feel that spontaneous desire out of the blue. So in the last 25 years or so, we've had a much broader understanding of what sexual desire is, and we understand it to be something that is responsive. So a great analogy is thinking about when you feel happy. Why do you feel happy? You feel happy when good things happen to you. Someone says something nice, someone gives you something, someone elicits a smile on your face, and it pulls out that feeling of happiness. Sexual desire works exactly the same way, and it's responsive to feelings of excitement in the body. So how we now understand sexual desire in many individuals, especially people in longer term relationships, more so women than men, although there are lots of exceptions to that, is that desire emerges after a person starts to feel sexual excitement and sexual arousal. So what that allows us to do is it allows us to normalize the person who might not feel desire at the start of a sexual encounter, but they might agree to sex for any variety of reasons, like they want to feel close to a partner, they want to have an orgasm, they want to feel pleasure, even if they're not feeling that at the outset. But if they can go through the steps and experience excitement and arousal, this directly paves the way for desire to emerge. And that's what we call responsive desire. And that's the kind of desire that can be cultivated. Brake pedal is really helpful. And Emily Nagoski, I believe, was the first person to write about this in her book, Come As You Are. And the idea is that there are a lot of things that we can put on the gas to rev up sexual desire. So things like increasing attraction levels, eliciting arousal and desire through the use of erotic stimuli or fantasy in the mind, or maybe certain smells or touches that really pull out sexual desire. But there's also a brake pedal. And the brake pedal is what are all of the things that are actually inhibiting sexual desire? Things like distraction, negative body image, worry about how the encounter is going to go, worrying about the orgasm, thinking about a partner being disappointed, being distracted by the to-do list. What do I have to do tomorrow? Is someone going to walk in? Will I get an STI? The list can go on and on. And experts would argue that we have not spent enough time really understanding what are the factors on an individual's brake pedal. We're spending too much time focusing, what are the elicitors? How can we bring this about? Whereas it turns out that there's a lot of things that impede the experience of sexual desire. So for any individual person, it can be really helpful to understand and document and start to pay attention to what are the various things that elicit and facilitate, and the different things that inhibit or impair my sexual desire. So it's probably worth declaring at the outset, and a lot of research has shown this, that sexual desire and sexual satisfaction in general is an aspect of health and quality of life. So the big studies have shown definitively over and over, and it doesn't matter if the research participants were men or women, if they were younger or older, or if they lived in a westernized country or in an Eastern country or a lower middle income country, that there is a link between higher sexual satisfaction and higher markers of physical and overall health. So people who are more satisfied in their sexual lives, and I should insert a caveat, and being more satisfied doesn't necessarily mean having more sex, because if the person is having unsatisfying sex or sex that is painful, that's not going to lead to greater sexual satisfaction. So it's worth thinking much more about quality over quantity. But among those people who have higher levels of sexual satisfaction, they're also more likely to report better heart health, better immune function. They're less likely to get sick. They're more likely to have other kinds of physical activity. They're less likely to be on medications. And then on the more relational side, they're far more likely to have good communication in their relationship. They're also far more likely to have good sex-related communication. So a comfort level with communicating to a partner about sex. Now, that doesn't mean that couples who are sexually satisfied never fight. That's impossible. But the ability to have kind of conflict resolution and problem solving is also associated with higher levels of sexual satisfaction.